Hi, my name is Ella, and I wanted to share a very important lesson to all future healthcare providers. The most important message I would like to display here is things are not always what they seem. You may have a patient that looks completely healthy, that doesn't look like they have any sort of chronic illness. So, let me ask you, do I look like a healthcare professional or a patient? Well, sometimes when a patient presents to the ED, they may look just fine. But you can't really go off that. You have to order blood work. You have to do an assessment. You have to, not just look up and go, oh, they're fine, they're fine. No, because if they were fine, they wouldn't have come to the emergency department. Patients, that is. So, anyway, this stethoscope, this is an important tool that I use on a daily basis to actually deal with my health. Here's another secret. Not everything is in your medical dictionary or your textbooks or even in your school. Sometimes you'll have patients who are sometimes referred to as med student show and tell, and for good reasons. I may look completely healthy, but at first, so did Casey Terry. Casey Terry was 5 years old when doctors missed the symptoms of type 1 diabetes. As a result, Casey was not giving insulin in the appropriate amount of time. That resulted in suffering a traumatic brain injury. Casey was a miracle. She never was able to learn to talk or walk or ride a bike again, but she got closer than anyone ever thought. They unplugged her from life support, and our little hero started breathing on her own. For 111 days, she was inpatient, fighting for her life, defying the odds. July 4th came around. Casey was presenting with some respiratory issues. She was once again life-flighted to the hospital that had saved her life before. She ended up surprising everyone. She was doing miraculously better. And then her parents took her home, and one night on July 11th, 2015, around 4:30 a.m., Casey flew to heaven at the age of 5. Today, Casey would be celebrating her 8th year of life. That's another surprise. That was not a baby crying. That was an alarm letting me know that my blood sugar is high. Surprise again. This is my insulin pump. This is what gives me my insulin. There are multiple factors that go in to managing type 1 diabetes. But when treated in time, or when healthcare professionals are able to work efficiently and quickly and to prioritize properly, type 1s can grow up and live lives. Casey didn't get that chance. I wish every healthcare professional would not just go with their brain, but their gut as well, or vice versa. Here's another surprise for you. I'm a survivor of many things. I have a lot of complex, rare medical conditions. I have the rarest kind of type 1 diabetes in the world. It's called brittle, sometimes volatile or labile, depending on where you are. Despite 15 to 20 blood sugar checks every day, those spots on my fingers are from all the blood sugar checks over the past 20 years. I've been living with a chronic illness since I was 2 years old. And at that point, from age 2 to 19 and a half, the only thing I had to deal with was type 1 diabetes. When my blood sugar would go low, I would just have to have a snack. In worst case scenario, I'd have to have glucagon, but no hospitals required. When my blood sugar was high, I would have a little Zofran that would melt in my mouth, and that would work. And then once the throwing up stopped, we'd take lots of insulin and push fluids, PO, and I would be fine. In August 11th, 2014, my life again changed forever. That was the day that I began my journey with gastroparesis, a form of dysautonomia and autonomic neuropathy. While I do not suffer these things as completely the result of brittle type 1 diabetes, they are a thing that presents piece by piece, and now multiple organ systems are affected, including my heart, my GI tract, and some other stuff that I don't really want to mention online. But anyway, over the past 3 years, I've spent over 500 days in the hospital. Since then, I've gotten to know how hospital systems work, given the fact that I have spent more time than a full-time nurse does in the hospital. A year. So, this is one of my favorite books. Why do I have Scrubs? What's the other reason I have this? Because I want to be a super nurse someday. While I don't fit in to this necessarily, and thousands of my friends don't, because we're rare, the thing that all patients have in common, and healthcare providers alike, is we are human beings. I have 2 things that I want to share. 1, I ask that all healthcare professionals and all future healthcare professionals remember that you are dealing with people. We are humans. We deserve the same compassion and respect as anyone, regardless what's going on. The second is, please remember to take into consideration what a patient has to say, and if they really are saying, hey, I really need this checked, check it. What's the worst that could happen? Oh, it comes back normal? But what's the other part if it's missed? On behalf of all of my friends who have passed away because of medical system failure, I ask that the next generation of healthcare providers, please arm yourselves with not just what you learn in school, but with the compassion that you have. Do not go into medicine for money. Go into the field of medicine or healthcare because you want to help make a difference in this world. So, before you go to med school or nursing school or anything in the healthcare field, please ask yourself, what is it that makes you want to do that? Why do you want to do that? And what do you hope to get out of doing that? If it has anything to do with money, consider something else. If it's because you want to look cool, think of something else. Or whatever. If it's because you genuinely care and want to make this world a better place and reduce suffering and help people, please go running to MedBooks. Please get your MCAS out, get everything. Please go into healthcare. On behalf of multiple people with chronic illness, I thank you for your time.